Before we start this video, I'd like to issue a trigger warning for child abuse and child sexual abuse. Please proceed with caution.
He has that personality thing.
What personality thing?
Oh, you know what I'm talking about. The multiple personality disease. You know, that, what's her name had.
The thing you're asking about, Sean, is referred to as dissociative identity disorder.
Dissociative identity disorder, or DID, was first included in the DSM-3 in 1980. At the time, it was known as multiple personality disorder, but it changed to DID in 1994.
You know how rare that is?
I'm not saying all of Santa Barbara has it. Just Robert, one guy. I think that qualifies as pretty rare.
The prevalence of DID is estimated to be around 1 to 1.5% of the general population. That is a little over 83 million people worldwide. These numbers indicate that DID isn't as rare as previously thought, and is comparable to schizophrenia in terms of numbers.
You don't know what it's been like. I can't work, I can't concentrate. I wake up in the morning more tired than when I went to bed. Days pass when I can't remember what I've done.
Some key symptoms of DID include memory issues, such as amnesia and dissociation, depersonalization, feeling like you aren't real, derealization, feeling like the world isn't real, somatic issues, such as phantom sensations and experiencing pain without a clear physical cause, emotional issues, such as sudden emotional shifts, hearing voices, and identity alteration, in which there is a difference in voice, mannerisms, and even physical characteristics between identities.
We think Tobias Henkel may have murdered his father.
Good for him. You know, Tobias's mama ran off with another man when he was 7. His dad went Section 8, started preaching about sin, end of the world stuff. He beat Tobias silly.
Kevin's mother had rather malevolent ways of punishing a 3-year-old.
One night, when I was 4, I was babysat by a 17-year-old neighbor. Mum and Dad were getting me out of the bath as he arrived. I was in a towel. He called me a tease, and yeah.
This is all your fault! This is all your fault!
Traumatic childhood events are reported by 97% of DID patients, 85% of whom experience sexual abuse. Usually, these events take place before age 5. Most researchers and clinicians agree that early childhood trauma is the main cause of DID.
Mark, open this door. Open this door right now.
Just let my mom.
Open this door.
Bloody hell. Look at the state of this place.
What causes alters to form? The answer is disassociation. The main goal of disassociation is to remove traumatic events from the child's consciousness. It's a defense mechanism that allows the abused person to escape awful suffering. It protects the mind from specific thoughts, memories, and feelings. Unlike adults, children can engage in this process more easily. And if this process is disturbed by repeated abuse in the sensitivity period, which is a developmental area from birth to age 6, a child may develop alter personalities.
So how many are?
There's 10 of us.
Developing new alters can seep into adulthood because people with DID fail to develop normal processes that integrate and modify behavior into a cohesive whole. From this information, it is far more likely that DID is caused by environmental factors like child abuse rather than a neurodevelopmental disorder.
I just wish I had more of a handle on what happened to me.
Your alters know. That's why the system was created, to protect you. So you could live through school, so you could go to college, so that you could meet and marry Max and raise those amazing kids.
A person with DID usually refers to the different parts of themselves as a system. In this system, different alters serve different purposes. Hosts, or daily life alters, are largely cut off from the traumatic memories and are quite functional. The trauma holders of the system are far less functional. They're often fixated on traumatic events and remain locked into the time of the trauma.
You look beautiful. Regina.
Thank you.
evaluations do not represent us. They are everybody just take a minute.
Tara, you just stand there and take it.
I know, I can't.
I mean, I feel like we're taking
Okay.
Tara.
What a marvelous shade.
When one alter transitions to another, it is called switching. Unlike most of the clips we just saw, this is usually a smooth transition and is difficult to detect.
I mean, it is really hard for me to see my sister like that. I never thought she would still be this way.
She's really not doing that bad.
I mean, why can't she just stop? I mean, it's not even a real disease, Max.
It's real, Charmy.
DID is still a controversial diagnosis. Many skeptics who believe the disorder isn't real adhere to the fantasy model. This is the belief that DID is prominently due to high levels of fantasy proneness and suggestibility. One reason for this way of thinking is that textbooks for students can hold inadequate information about trauma and dissociation. Another reason is the reluctance to accept the severity of childhood abuse that individuals with DID report. Subconscious protective mechanisms can take over to deny the reality of such abuse, in a similar way as it does with denying racism, the Holocaust, or global warming.
The differences in the identities can be dramatic, as much as the difference between you and me and every person in that auditorium.
In 2003, the first multi-participant stimulus-driven brain imaging study revealed that the brain processes information differently based on what alter was active. These brain activation patterns between different alter states were replicated in an independent sample, which then discredits the fantasy model altogether.
I shouldn't have brought him in that cave. I shouldn't have brought him in the cave. Hey. You were just a child. It wasn't your fault.
Research suggests a close relationship between dissociative PTSD and DID. These neurobiological similarities support a trauma-related etiology, the causation of DID. Brain activation studies have validated the DSM-5 criteria of DID by showing that alters respond with their own distinct pattern of brain activation in response to trauma-related information about their life. There can also be differences found in ECG recordings, hormonal profiles, cerebral blood flow, sensation of pain, and the course of the menstrual cycle.
Why are we talking about him like he's a different person? It's
This
you.
is why I don't talk about it. It's why I don't talk about it, because it's impossible to explain it to somebody when they haven't experienced it.
With all this evidence, it remains unclear why DID is still so controversial, especially since the etiology, or causation, for many other major psychiatric disorders, such as psychosis, is also significantly unknown.
Doctors have diagnosed you as having a split personality.
A schizo.
Okay, let me explain. Again, schizophrenia is when you hear voices, like the radio people. I don't have that. I don't hear voices.
Right, you do the whole character.
People with DID may be misdiagnosed with schizophrenia due to hallucinations and, despite what we just heard, hearing voices. Although not everyone with DID hears voices, it is a common symptom. Typically, in schizophrenia, people will hear external voices, but in DID, it's internal.
You can't die from insomnia.
What about narcolepsy? I nod off, I wake up in strange places, I have no idea how I got there.
You need to lighten up.
Can you please just give me something?
Since the debate about DID is high, there is a reluctance to diagnose it. Individuals receive an average of 4 prior other diagnoses, as well as an inadequate pharmacological treatment, several hospital admissions, and, consequently, spend many years in mental health services, all because of the lack of awareness about the disorder. People who have this disorder are also at a high risk for self-harm and suicide.
Who are you? I'm your therapist, Karen Descala. Have you seen me before?
While there is no cure for DID, symptoms can be managed with medication and therapy. Outpatient psychotherapy is the main treatment used, and it comes in 3 phases. The first phase is achieving stability. The second is working through trauma, and the third is integration.
I just can't! If pushing this button is gonna get rid of you guys, then I won't do it! Hey, yo, don't think of it as getting rid of us for good. We'll all still be a part of you in a way.
Integration is where all identities merge into one functional person. However, not everyone who is in treatment for DID wants integration to be their end goal, and recovery to them is more about accepting every part of themselves.
Maybe the killer's on the security footage. No, it can't be!
Freeze! My name is not Regina.
Hold it! Torch that door, do you hear me? I'll kill your parents! I'll kill your friends! I said get that fucking door open!
I'm trying, sir!
The idea that people who have dissociative identity disorder are violent stems from the media, where an alter is shown to be violent. However, there has been no evidence that people with DID are more at risk for violence than the general population.
Have I ever let us down? How far have you come because of me?
That's Robert's other personality, the violent one. But why would he kill Dr. Blaine? Depends entirely on what Regina was seeing him for.
He's done awful things to people, and he'll do awful things to you.
I'll take boring Mike over evil Mal any day.
The media usually portrays DID where one alter is a sadistic killer and the other is unaware of the crimes being committed. Typically with this trope, either the evil alter is killed off, or both the evil and the innocent alter are.
His body committed these murders, that is true. The person who remains inside did not.
If someone with DID does commit a crime, the diagnosis of the disorder will prevent them from being executed. A rehabilitation center is sometimes mandated, but these people usually end up in jail. A person can plead to their disorder, but this approach is rarely a successful defense against criminal liability. Additional training is needed for jurors to recognize DID, as the complexity of the disorder can affect the case.
You fuck me, then snub me. You love me, you hate me. You show me a sensitive side, then you turn into a total asshole. Is that a pretty accurate description of our relationship, Tyler?
We have just lost cabin pressure.
What did you just say?
What is wrong with you?
What did you just call me? Say my name.
Tyler Durden. Tyler Durden, you fucking freak. What's going on? You know, the weird thing is like, I kind of feel like everyone has it. You know, a little bit. It's like over the course of a day, how many different women do we have to be? You know, the work Tiffany or sexy Tiffany or dog owner Tiffany. You know, it's hard, right?
While every human has the capability to dissociate, those of us who live with dissociative identity disorder manage life by switching, which can be heartbreaking, exhausting, and painful for us and others.
You met Little and Spike.
I'm sorry about the dogs.
Sorry about Spike's mouth. I can't always control my switching.
From the moment you arrived, way back then, we were so young, you saved me. I survived because I knew I wasn't alone.
I don't mind switching. It is literally how I have managed my entire life. Each part serves a purpose. Each part contributes to managing my life. It saved my life. It's not scary anymore. I love my parts. For me, though, the most distressing, the most heartbreaking, and the most devastating component has been the struggle to remain in relation with people we love, and having to take accountability for all parts of my DID system and hurting someone's feelings, while another part of me wasn't present for it. Linked in the description will be some resources about DID. I urge you to check them out and continue educating yourself. Thank you so much for watching, and take care.